At Santa Rosa Community Health, we offer all patients 15 and older a once-in-a-lifetime HIV test. Some patients, however, may be advised to test more often. Frequent exposures require frequent testing. Sometimes a retest is required 4 to 6 weeks after a negative test if there's been a particularly high-risk exposure, such as anonymous sex, sex in exchange for money or drugs, or having sexual partners found on apps such as Grindr.
Yes, science has come a long way, and there are many options to prevent the spread of HIV, even when regularly exposed. This treatment is called PrEP, pre-exposure prophylaxis, and it is a 1 pill a day preventative treatment to stop the spread of HIV. Make sure that patients know this is an option. Provide an educational pamphlet, and if the patient is interested in finding out more, send a referral to our PrEP medical care provider.
While people with HIV are living longer, healthier lives, we still want to do our best to prevent patients from contracting or spreading HIV. Here are some basics to remember. The only way to tell if someone has HIV is to test them. There are 5 fluids that transmit HIV: blood, semen and preseminal fluids, rectal fluids, vaginal fluids, and breast milk. The primary way that HIV is spread in the United States is by having condomless sex. Sharing injection drug equipment, such as needles, can also put someone at risk for contracting HIV. If your patient participates in either behavior, let them know about PrEP services as a form of HIV prevention and offer a referral to a PrEP service provider on our team. If a patient is in clinic and reports condomless sex, assault, or use of a shared needle, immediately call Team Vita to get the patient on a treatment called NPEP. NPEP stands for Non-Occupational Post-Exposure Prophylaxis. This is urgent and is essential to get the patient in as soon as possible because medication must begin within 72 hours of exposure, and the sooner the better. If your patient has expressed fear of exposure, call Team Vita right away so they can be seen immediately. If a patient calls and reports sexual assault, direct the patient to the ER, and you should also call Team Vita to keep the medical care team in the loop. Although the cost of medications are high, programs exist to cover the expense. Depending on the patient's annual income, all or a good portion of the treatment costs are covered. The point is, a patient should never worry about the cost of HIV treatment and care.